A patient with a history of schizophrenia says the medical staff is secretly employed by the CIA to take me out. The nurse should respond as follows. A. The CIA protects us and is not out to hurt you. B. No other patient thinks that. C. I want to help you, not harm you. It must be frightening thinking people want to hurt you. D. When did you first start having these thoughts? Answer is C. I want to help you, not harm you. It must be frightening thinking people want to hurt you. The best therapeutic communication with a schizophrenic patient is to acknowledge their fears while also developing rapport with the patient as a nurse. This statement best meets those needs. A patient with schizophrenia will truly believe in the statements they are making, so the nurse should not try to convince the patient they are wrong, as this may develop distrust between the nurse and patient. The focus should remain on the patient and their beliefs. The nurse should not bring other patients into the conversation. As to answer option D, this statement does not acknowledge that the patient's thoughts are their reality. The patient may also not know the answer to this question, and the nurse will not be able to develop rapport with the patient. Which of the following patients should a nurse recognize as having an increased risk of breast cancer while doing breast cancer screening? A. A 44-year-old who has had 5 children. B. A 28-year-old who is breastfeeding her first child. C. A 35-year-old who started her menstrual cycle at age 12. D. A 61-year-old who has not had children. Answer is D. A 61-year-old who has not had children. The risk for breast cancer is increased in elderly patients who have not had children. Patients who have had children are at less risk for breast cancer than those who have not had children. Breastfeeding decreases the risk for breast cancer. A patient who started her menstrual cycle at age 12 would be a decreased risk for breast cancer. Patients with irregular cycles or who started at an earlier age may be at an increased risk for breast cancer. A patient is scheduled for surgery to have his appendix out due to acute appendicitis. The patient says, I don't think I need surgery now because I feel better. A nurse should respond as follows. A. I will have your spouse explain the procedure to you again. B. I will call your doctor to explain the procedure to you. C. I will explain the procedure to you and answer any questions you have. D. Your appendix may rupture and that could cause serious problems. Answer is B. I will call your doctor to explain the procedure to you. It is most appropriate to notify the doctor that the patient is rethinking about receiving the surgery. The doctor will need to discuss their options again and reinforce to the patient that surgery is required or not. It is not appropriate for the spouse to explain the procedure to the patient. This should be done by medical staff. The patient may have questions that can only be answered by the doctor, therefore the doctor should be notified. The nurse may not be able to explain the procedure appropriately and may cause the patient to distrust the medical staff, therefore the doctor should be notified as they may need to receive consent a second time. While preparing for discharge, a patient makes a statement to the nurse, I'm not sure I will be able to take care of myself at home. Who is the most appropriate team member to report this statement? A. Doctor. B. Physical therapist. C. Case manager. D. Director of nursing. Answer is C. Case manager. The case manager is the most appropriate healthcare team member to report this kind of statement to, especially around discharge. An assessment may need to take place regarding the living and financial situation of the patient. The doctor and director of nursing would most likely refer the nurse back to the case manager, so it would be appropriate for the nurse to report this statement to the case manager first. A nurse just started a blood transfusion for a patient with a hemoglobin of 6. The patient says, I feel hot, my stomach hurts, and I am having difficulty breathing. What should be the nurse's first action? A. Notify the physician immediately. B. Stop the infusion. C. Take vital signs. D. Call a code. Answer is B. Stop the infusion. The first action should be to stop the transfusion immediately once the patient complains of any unusual symptoms. The patient is reporting symptoms of a transfusion reaction, therefore the transfusion should be stopped to prevent the patient from worsening. The provider should be notified immediately after stopping the transfusion. Vital signs should be taken as quickly as possible or as instructed by the provider after the transfusion has been stopped and the physician has been notified. A code should be called if the patient becomes unresponsive. A rapid response could be called if the patient is at risk of destabilizing.